Hello, I am Dr. Eren. I am an anesthesiologist at the Hair Center of Turkey Clinic. Epilepsy is a neurological disorder characterized by seizures. The question of whether hair transplantation can be performed on epilepsy patients frequently arises. For these patients, it is particularly important for us to know whether they have had a seizure in the last 6 months to 1 year, whether they are taking their medications regularly, or if they have had any intensive care hospitalization or emergency service visits since being diagnosed with epilepsy. When you contact us, we accept our patients for the hair transplantation procedure after at least a 3-month seizure-free period. And we recommend continuing epilepsy medications before, on the day of, and after the procedure. There are some important points to consider during the hair transplantation procedure, especially for epilepsy patients. These are measures to ensure that patients do not experience pain, do not become dehydrated, and to prevent infection. Since we perform hair transplantation under sedation in our clinic, we prevent our patients from feeling pain and avoid the development of seizures. Close monitoring and follow-up are especially important for epilepsy patients. You can reach out to us to safely perform a hair transplantation procedure. If you have any questions about this topic, please mention them in the comments. For more videos like this, don't forget to like our video and subscribe to the channel.